Hi, I'm Dr. Perry Gadalovich, and in this video I'm going to be reviewing the consent form for awake liposuction. Awake liposuction is one of the most common procedures we do at FI surgery, and I love it because it allows us to really shape the patient in different positions, even standing up, to make sure that everything looks good. For awake liposuction, it is done under local anesthetic with an oral sedation, so please go view the pre-op instructions for local anesthesia with oral sedation. In order to get the oral sedation and give it a chance to work, you'll be receiving the medication approximately 1 hour before the start time of your surgery, and it will remind you again that you need to be fasting for 4 hours to avoid any nausea and vomiting. There is a little bit of discomfort associated with the local anesthesia, and so when we're freezing you, you may feel a little pinch. You can have some palpitations because there's some adrenaline in the medication, and some people can develop an allergic reaction. It's extremely rare, and I've never seen it. The oral sedation that we give you can also have side effects. Those side effects are wanted, but include grogginess, sleepiness, being forgetful. You may actually fall asleep during the procedure, and you may forget some periods during the procedure. Some people can get emotional. This is unusual, but it can happen. It is a side effect of the medication. The other risks of liposuction include bleeding, which is extremely rare, bruising, which is common and everybody gets it, swelling, which is also everybody gets it, but varying degrees. We will place you in a post-operative garment in order to prevent as much of the swelling as we can. The tiny little scar that we use for the incisions for the liposuction can take some time to heal, and those scars tend to fade over 1 to 2 years, but every once in a while we'll have a patient whose scar is a little bit worse and a little bit darker, and we will do everything we can to improve those scars. The areas that are going to have liposuction are going to tend to have funny sensations, numbness, tingling, burning, and those are normal. The most undesirable complication from liposuction is what we call a contour deformity. That means it's like a hole in the fat. It's extremely rare for it to happen or to be very visible. Sometimes little areas can happen, and it usually smooths over 6 months to a year. But this is why it's important in the first 3 weeks to really wear your garment, and we will provide the garment for you. One of the other things that we always mention to people when we're doing liposuction is that the contraction of the skin is different in everybody, and it's different depending on your age and the quality of your skin. Once we remove the fat, the skin will tend to naturally contract. The degree to which it contracts is individual, and even though we try to predict and make sure that your skin will be as tight as possible, it is not something that we can control, and every once in a while somebody will say, oh, I wish that my skin had tightened up more. And there are other things that we can then offer you, but that's something that you need to know when you're getting liposuction. Infection is extremely rare, and I've never seen it, but we do give antibiotics to everybody. And asymmetry is common, so your two sides of the body are not the same in any human being. We try and give you the most symmetrical procedure that we can, the most symmetrical outcome that we can, but there will always be little differences between both sides. It is important to know that during awake liposuction, there are periods of discomfort for which we will also offer you laughing gas. It is extremely tolerable, and often patients are laughing through the procedure. But if you're somebody who cannot tolerate seeing any kind of blood or being awake for surgery, then this is not a procedure for you, and you should discuss with me again finding a different solution for you. I encourage you to read carefully through the rest of the consent form and to ask the nurse who calls you for your preoperative appointment any further questions that you might have.